What if I were to tell you that you really don't have high blood pressure? Today, we're going to go over the top 10 errors that people make when they're taking their blood pressure, and then we're going to tell you how to do it the right way. Mistake number 1, using a wrist cuff. Wrist cuffs are convenient, but very inaccurate. There's a lot of position problems there. They just don't work. It's hard to use them and get them to work correctly, and therefore you get a lot of errors. For a proper reading, the wrist cuff must be exactly the level of your heart. Any deviation, even just a few inches up or down, can significantly skew those results, leading to falsely elevated readings and sometimes low readings. Wrist cuffs show more variability compared to upper arm cuffs. They're the gold standard, the upper arm cuff. To ensure accuracy, get a validated upper arm cuff that's been tested for reliability. This small change can dramatically improve the accuracy of your readings. If you must use a wrist cuff, ensure that your arm is fully supported and at the level of your heart, and that you keep it motionless. Don't move it at all. Keep it at heart level and try to mitigate those risks. And just better yet, don't use a wrist cuff. Mistake number 2, not resting before you measure your blood pressure. Imagine rushing into a doctor's office, climbing the stairs, or dealing with traffic stress and running across the street and up the stairs before getting your blood pressure checked. That's very common, and it leads to a lot of errors. Remember, rest for 5 to 10 minutes before a measurement, at least 5, preferably 10. That allows your heart rate and your blood pressure to stabilize. Also remember not to drink coffee, energy drinks, or smoke at least 30 minutes before the test. And here's the thing, just don't smoke, period. And really don't use energy drinks. Even mild exercise can influence your blood pressure reading. So remember that. These scenarios are common, and failing to rest before a measurement can lead to artificially high readings. Skipping this step can result in overdiagnosis of high blood pressure and unnecessary medication. For home measurements, create a calm environment by sitting in a quiet space and practicing deep breathing. Mistake number 3, incorrect arm positioning. The position of your arm during a blood pressure reading is critical, and if the arm is too low, the reading will be falsely high. Ideally, your arm should be supported and at heart level. Now let's think about it. Think of yourself as a big sack of water. You know, when you're in a water tower or even when you're diving in the ocean or a lake, the lower you go in that column of water, the higher the pressure, because water weighs more than air. So the lower you go in your body, when you consider yourself a sack of water, the higher the pressure. So the highest pressure is going to be down in your ankles. The lowest pressure is going to be up here. Improper arm positioning can result in measurement errors of up to 10 millimeters of mercury. That's a big number. Many people unknowingly let their arm dangle or rest on their laps, leading to incorrect results. Now, using an armrest or a table to support your arm can help you achieve that correct position where the cuff is at heart level. Consistency in arm positioning is key to obtaining reliable readings, whether you're measuring at home or in a clinic. Also, ensure that you're seated with your back supported and feet flat on the floor, as improper posture can cause more problems, more inaccurate results, and inappropriate treatment. Mistake number 4, talking during measurement. Talking while getting your blood pressure taken is a problem. It might seem harmless, but it's not. It can significantly affect your results. Talking increases heart rate, and it can raise systolic blood pressure by up 10 to 15 millimeters of mercury. And again, that's a lot. Even breathing impacts your heart rate and your blood pressure. So think about that. Verbal distractions can lead to inaccurate readings, especially in clinical settings. So avoid this mistake. Remain silent and relaxed during the measurement, and breathe deeply. A quiet environment can make a noticeable difference in the accuracy of your blood pressure reading. If you're measuring at home, turn off distractions like the TV or radio. Maintain a calm atmosphere. Here's mistake number 5. Using the wrong sized cuff. Using a cuff that doesn't fit properly is one of the most overlooked errors in blood pressure measurement. We see it time and time again, even in the doctor's office. A cuff that's too small is going to give you false high blood pressure, while one that's too large is going to give you false low blood pressure. For example, individuals with larger arms, they use a standard size cuff, they'll consistently get high readings and don't actually have those high readings. To ensure accuracy, measure your arm circumference and select a cuff that fits within the manufacturer's recommended size range. Many devices now come with interchangeable cuffs or options for larger sizes to accommodate this specific issue and the various needs of larger arms. Now, not securing the cuff tightly enough can lead to errors as well. The cuff may not exert the necessary pressure to measure blood flow accurately. That cuff is measuring the pressure needed to impact the flow and even stop the flow of blood in that artery. So when purchasing a blood pressure cuff or monitor, look for models that include clear guidelines on cuff sizing and positioning, as these are critical for reliable results. Regularly inspect the cuff for signs of wear and tear, such as fraying or loss of elasticity, to ensure ongoing accuracy. But that's not all. We've got some more mistakes here, and again, they are common too. Mistake number 6, measuring at the wrong time of day. Blood pressure naturally fluctuates throughout the day, peaking in the morning and dipping at night. Cortisol tends to peak in the morning and dip at night, and it tends to impact your blood pressure too. Measuring at inconsistent times can lead to misinterpretation of your readings. For example, a morning reading might be higher due to the body's natural circadian rhythms, and, as we mentioned, cortisol, while an evening reading is likely to be a little bit lower. This variability can create confusion and result in improper treatment decisions if the trends aren't accurately tracked. So what I recommend is that you put the time of day beside every blood pressure reading that you record. Now, you can also just measure your blood pressure at the same time each day, and preferably in the morning, so we know what it is. And you're looking at that, what tends to be the highest level. Early morning, early evening, both of those are commonly checked. Those are generally recommended. Consistency is the key. And again, notifying us, marking whether it's morning or evening. Keep a log of your readings. Help your doctor identify patterns. 1 or 2 blood pressure readings does not. It helps, but it does not give us the whole picture. It doesn't allow us to make informed decisions about your health. Consider using a digital monitor with memory storage to simplify tracking and provide accurate reports to your healthcare provider. Mistake number 7, placing the cuff over clothing. Placing the cuff over clothing rather than directly on the skin is another very common error. And again, we even see it in doctors' offices. They make an assumption, this is light, thin, it's not going to impact it. Don't trust that. Don't try to make an estimate. Especially thick or tight clothing clearly will interfere with the cuff's ability to compress the artery properly, leading to a false high or inconsistent result. Even clothing that might seem thin can sometimes do this, so just don't do it. The American Heart Association recommends rolling up your sleeves or removing restrictive clothing to ensure the cuff sits directly on your bare arm. And whether or not you have some arguments with the American Heart Association, most of us in the low-carb community often do, and I have others as well, but I don't argue with them about this at all. They're right here. Don't wear restrictive clothing, roll up your sleeves, do your blood pressure measurement on the bare arm. For best results, choose loose-fitting attire, loose-fitting clothing, when you know your blood pressure is going to be checked when you go to the healthcare provider. Additionally, ensure that there's no bulky jewelry or accessories. You just don't want to obstruct the cuff's placement. Now, these simple adjustments can make a big difference in getting accurate readings. Mistake number 8, not emptying your bladder first. A full bladder can increase systolic blood pressure by as much as 10 to 15 millimeters of mercury. Believe it or not, and yes, the evidence is out there. The research has been done. This is especially problematic, especially in clinical settings when patients just don't think about it, when they don't think about going to the bathroom. They don't think about emptying their bladder before the appointment. And then sometimes when you get in there and you're waiting in the evaluation room, you might have to pee, but at that point, maybe you're a little bit embarrassed. Don't be. To ensure an accurate reading, always empty your bladder before getting your blood pressure taken. Mistake number 9, using a poorly calibrated device. Blood pressure monitors, like any medical equipment, require periodic calibration in order to maintain accuracy. A poorly calibrated device can consistently provide wrong, inaccurate readings, leading to misdiagnosis or, again, improper treatment. Many manufacturers recommend annual calibration checks, which is often performed at a pharmacy or by the manufacturer. If you've been using the same device for years without maintenance or calibration, it's time for a checkup or an upgrade to a newer, validated monitor. Investing in a reliable, well-maintained device is essential for long-term health monitoring. And if you think, oh, that's too expensive, it may not be. Compare that to the copay for inappropriate medications, or compare that to the health impact of a wrong diagnosis. Look for monitors that meet international standards for accuracy and keep a record of calibration dates to ensure ongoing reliability. Mistake number 10, not taking multiple measurements. Relying on a single reading can be misleading, as blood pressure can fluctuate up and down due to stress, posture, or even room temperature. Taking 2 or 3 readings in quick succession and averaging them out provides a much more accurate picture of your blood pressure. Many modern devices include a feature to calculate the average of multiple readings automatically. Ensure that you wait 1 minute at least between those measurements to allow your blood vessels to return to their baseline state before pumping that cuff up again. This practice minimizes the impact of temporary factors and ensures that your readings are as accurate as possible. For even greater accuracy, measure your blood pressure over several days. Share the averaged results with your healthcare provider. In fact, give him or her all the numbers. And don't forget to put down the time of day by each reading. Now that you know the mistakes that you might have been making, see how to accurately take your blood pressure. First of all, prepare before measurement. Number 1, avoid caffeine, alcohol, exercise. Refrain from using these things. Caffeine, alcohol, and smoking, all these things, don't do any of them before 30 minutes before measurement. Avoid intense physical activity. Intense physical activity within half an hour before taking your blood pressure. You do need physical activity as part of your health behavior, but not when you're trying to measure your blood pressure. Number 2, empty your bladder. Number 3, sit in a quiet, comfortable place. Rest for at least 5 minutes. Take a deep breath before taking the measurement. Correct your positioning. Sit with proper posture. That's number 4, by the way. Sit with proper posture. Sit in a chair with back support, feet flat on the floor, and legs uncrossed. And if you're thinking about it, and yes, I heard it before, I did it wrong. I actually had my legs crossed on one of our more popular videos, the one where we looked at ABI, ankle brachial index. Oh, did I catch a lot of grief about that? And I should have. I was wrong. I don't do that anymore. Number 5, support your arm at heart level. Place your arm at a table or armrest where your upper arm is at heart level. Number 6, use the correct cuff size. The bladder on your cuff should wrap around 3/4 of your upper arm circumference. Number 7, place the cuff properly. Wrap the cuff snugly around the arm, not too tight, not loose. 1 inch or 2.5 centimeters above the crease in the elbow. The artery marker, if present, should align with the brachial artery. That's going to be right about here. Number 8, remain still, silent. Avoid talking, moving, fidgeting during measurement. For some of us, that's kind of hard. Number 9, take multiple readings. Take at least 2 readings, 1 minute apart, and average them. If readings differ by more than 5 millimeters of mercury, take more readings to get it into the average. Number 10, measure both of your arms. Measure your blood pressure in one arm and then use the other arm. Take the higher reading as the reference arm for future checks. After the measurement, number 11, record your readings. Don't try to remember it. There's just too many of them. Record the readings. And what else did we say? Record the time of day of that reading. If monitoring blood pressure at home, take readings at the same time each day, or at least make sure that you record the time that you're reading it. Number 12, consult with a professional. If readings are consistently 140/90 or higher, or 130/80 in people with diabetes, and remember, even if you think you don't have diabetes or prediabetes, most of us that think that actually do have it. So really focus a little bit more on the 130/80. And if you have 130/80 multiple times, see a healthcare professional. But there's another reason your blood pressure might be high, and we haven't covered it yet. It's called white coat hypertension. Now, many people will say, oh, no, that's just not true. It doesn't exist. Well, it does exist, but it's not that simple. First of all, what is it? It's when you get blood pressure readings that are higher when you're in a clinical setting. And it's due to anxiety, having the doctor and the nurse around, having your blood pressure checked. It's often used to explain away elevated numbers. Oh, I got white coat high blood pressure, hypertension, so that means I'm really okay. Think a couple of times before you believe it. Because the condition is real, it's often overdiagnosed. And on a practical basis, here's the rest of the story. Research has shown, evidence is clear that most individuals with white coat hypertension also experienced elevated blood pressure outside of the doctor's office, indicating an underlying problem. And guess what? It's usually a problem associated with anxiety. So monitoring the blood pressure at home provides a clearer picture and often reveals trends that confirm genuine high blood pressure, real high blood pressure, rather than an isolated spike due to the anxiety at the doctor's office. In other words, if you think the only place that you have anxiety is in the doctor's office, you should probably think again. The bottom line is that high blood pressure should be taken seriously, regardless of whether it's attributed to anxiety from white coats or anxiety from something else or having a little bit too many pounds of fat around your middle or whatever reason. Take it seriously and don't look for excuses. Just take the blood pressure correctly and then you'll have a good diagnosis and then do the right thing. Let's talk about the underlying cause of this problem, and we have to think about metabolic disease. It's one of the most underappreciated causes of high blood pressure. In fact, the major cause of it. Undiagnosed diabetes or prediabetes or poor metabolic health. Now, if you're saying that's not me, okay, are you remembering that only 10% of us are metabolically healthy? But there's another way of looking at why. Here's the biological reasons. The connection lies in connection with chronic high blood pressure and insulin levels. These things can cause our kidney to retain fluid. It also causes widespread inflammation of the arteries and damage to those blood vessel walls. Advanced glycation end products happen. And yes, AGE, advanced glycation end products, but it's not growing old. Here's the most common AGE. It's where glucose has bound to a protein, and I bet you've heard of the one. If you're thinking this sounds technical, the most common AGE, advanced glycation end product, is hemoglobin A1C. You see, what happens is glucose binds to proteins. Now, why are we bringing up AGEs? Because AGEs, proteins like hemoglobin that have glucose bound to them, they're a product of prolonged high blood sugar levels. And these AGEs contribute to the stiffening of arteries and damage of pressure-related centers in the kidneys. They cause us to retain fluid. And here's the thing. Your blood pressure starts to go up. That causes more damage to the artery walls, which makes your blood pressure go up further, which often makes the metabolic disease worse. Does that sound like a vicious spiral? It is. And the problem is most people don't understand that vicious spiral. They don't check for it. And here's another thing to think about. By far the most common sign, first sign where people should be thinking, I might have metabolic disease. Of course, if you start gaining weight, but also if you discover you've got high blood pressure. Those are two of the most common first symptoms of metabolic disease. As we've said, prediabetes usually goes undiagnosed. Not often. It usually is undiagnosed. And it allows these harmful processes, this vicious spiral, to wreck your metabolism, wreck the tissues, and result long-term in heart attack, stroke, blindness, kidney disease, arterial plaque, if you're a male, erectile dysfunction, all these bad things. Now, addressing metabolic health through lifestyle changes, such as weight loss, improved diet, increased physical activity, all these things can reverse prediabetes and dramatically reduce your blood pressure. So, if you'd like to know how to diagnose metabolic disease, that's important, obviously. Just take a look in this video right here.